Hello, this is David Green, Education Director for Premier Pain Specialists in Chicago. Today's topic is what are the best treatment options for spinal stenosis? Well, what is spinal stenosis? It involves narrowing of the spinal canal and pinching of nerve roots, and it's usually due to bony and soft tissue overgrowth from the arthritis process. Usually occurs in patients over the age of 50, and it's often seen at multiple levels, and it's unfortunately not symmetrical. It might be greater on one side than the other. Here's a cartoon showing spinal stenosis, looking down at the spinal canal. You see the white area around the spinal cord. That's actually where cerebrospinal fluid would be, and this looks nice and happy. But when you start getting arthritis with soft tissue overgrowth from these joints in the back or from the disc, you end up getting pinching around various areas, okay? And as nerve roots try to come off from the spinal cord, those can get pinched. So the symptoms usually include an aching pain in the buttocks or on the legs on the affected side. May have symptoms of sciatica. In unusual cases, you may have some associated leg weakness. It often is mistaken for a hip joint problem. You think, oh, my hip has got an issue, but actually it's referred pain coming from the spinal stenosis around to the groin. Typically it's positional related, so leaning forward can often help a patient feel better as it frees up the nerve roots, gives them more room to breathe. So out of a textbook, you might see somebody say, I feel better when I'm in the shopping supermarket, leaning forward on the shopping cart, and that's because it's opening up the room for those nerve roots. And that's called neurogenic claudication. Vascular claudication needs to be differentiated. That's when you have peripheral artery disease and you have pain that usually starts in the calf. So it starts lower and then comes up the leg, as opposed to spinal stenosis, which is in the groin, buttock, and goes down. Most people with spinal stenosis have no symptoms at all. So treatment options should start basic with over-the-counter anti-inflammatories and Tylenol, possibly some neurogenic medications being prescribed, such as Neurontin or Lyrica. There have been studies showing those work well. Physical therapy, spinal decompression therapy, non-operatively may work. And then there are 3 types of epidural steroid injections that may help. The one that you see here is called a caudal epidural. At the very bottom, here's the lumbar spine and the sacrum. There's an area called the sacral hiatus where a large amount of numbing medicine and steroid can be injected, and it can migrate up and help with multiple levels that are being pinched. All right. Whether or not to have surgery for spinal stenosis is a true quality of life decision. Nobody ever died from spinal stenosis, okay? The decision should only be made after considerable conservative treatments fail. The surgical treatment for a lumbar spinal stenosis situation is a laminectomy, where some bone is removed that helps decompress and free up those nerve roots that are causing the problem. So here's looking from the back where you take this bone off and free up this area where the nerve roots come off. And if those are the ones being pinched, that will help with pain relief. It's a 1-hour procedure. Usually a fusion is not necessary. It is low risk, but it is surgery, and half of patients who have this done end up with stiffness in the back postoperatively. And you can also end up getting some scar tissue around these nerve roots that have been freed up. Okay. The bottom line is that surgery can be avoided over 90% of the time. Epidural injections can be repeated every few months. They do have a 75% good to excellent chance of providing relief with one of the various types of epidural injections. A spinal fusion, if they end up having a laminectomy, adds a whole level of complexity to the procedure. The top non-operative pain management in the greater Chicago area is with Premier Pain Specialists. There are several clinics in and around the city accepting over 50 insurances and providing over 25 different treatment options for conditions just like spinal stenosis. The board-certified, award-winning doctors provide medication management, interventional treatments, or possibly a combination. Visit us online today at ppschicago.com and then call us for more information and scheduling at 847-220-7907. Thank you very much for watching.